So I'll be talking about this topic, role of doxycycline in febrile illness. So this talk was given in Criticare 2020 National Conference in Hyderabad on 28th February. So I think this would be a pictorial narrative of the role of doxycycline in various febrile infections. So not necessarily it may be to do with infections that are present only in ICU. It may be other febrile infections as well. So as you see, the doxycycline is a derivative, and it's alpha 6 deoxytetracycline, and this was first discovered in 1967 as a derivative of alpha 6 deoxytetracycline. So the unique thing about doxycycline is it has effect against multiple variants of organisms, including gram-positive, gram-negative, atypical organisms, and parasites like malarial parasites. And another distinct advantage of doxycycline is it has a role in biological warfare as well for both prophylaxis and treatment. More so in this day and age where there is a threat of biological warfare, I think doxycycline remains a secret weapon against these agents. So how does doxycycline acts? So doxycycline predominantly acts by binding to ribosomes, 30S and 70S ribosomes. So as you see, this is a ribosome. So doxy binds to 30S ribosomes and inhibits protein synthesis. And how does it do? It prevents the binding of ribosome to amino acyl tRNA. So basically it prevents incorporation of this amino acyl tRNA into the ribosomes and inhibits the protein synthesis. Along with 30S ribosome, it also binds to 70S ribosome. So 30S and 70S ribosome and prevents incorporation of amino acyl tRNA and inhibits the protein synthesis. And along with it, it inhibits angiogenesis and it inhibits apoptosis, and it has ability to inhibit matrix metalloproteinases. You will see there is a very distinct advantage of inhibiting this. You will see in the later slides, I think, what is its impact or helpful role that we have in disease condition. And another way it acts is it creates spores and enters into the bacterial cell membrane and causes the death of the organism. So it enters the organism through the pore formation. So that is another mechanism as well. And it has shown to inhibit apicoplastic ribosomes, which impairs the synthesis of fatty acids and heme. So this mechanism, inhibition of epicocytic ribosomes, inhibiting the synthesis of heme, is the mode of mechanism of action for malarial parasites, because malarial parasites need heme for its survival. So by impaired synthesis of this, it has an activity against malarial parasites. So let's look into the pharmacokinetics and pharmacodynamics. So doxycycline is rapidly absorbed from the stomach, and half-life is around 18 to 22 hours. So if you look at the peak concentration, when it is taken orally, the peak concentration is achieved at 2 to 3 hours, and it attains a plasma concentration of 3 to 5 micrograms per ml. If you give IV, which typically in ICU we tend to give intravenous, which has been available from the recent days, the peak action happens in 30 minutes and it attains much higher serum concentration of 4 to 10 micrograms per ml when you give IV. The another distinct advantage of doxycycline is it is very much absorbed in the fat. So, and the fat, because of its ability to absorb in the fat, it is found in varying fluids at good levels. So, it has a good levels in lymphatic fluid, peritoneal fluid, colon tissue, and breast milk. So, which means it has a good penetration into multiple fluid present in the body. And what about CSF, which is extremely important? It has a reasonably good CSF penetration. So it attains CSF levels of about 0.37 to 1.3 micrograms per ml, which constitutes around 14 to 26% of the serum concentration. Which means 14 to 26% of the serum concentration is attained in the CSF, which is pretty good. And doxycycline, 82 to 90% of the doxycycline is protein bound. Okay. And the highest concentration of doxycycline is seen in the bile fluid, in the biliary system, and it's eliminated within 72 hours, and 54% of the serum concentration can be present in the genitourinary system. So that's why it is extensively used in pelvic inflammatory disease or any genitourinary condition. And 54% of them can be found in the placental circulation or in the cord blood and on the genitourinary system. That's why it's a very good agent if you are tackling anything to do with genitourinary system. And one third of it is eliminated from the kidneys. If in patients with kidney failure or where it is not eliminated, the rest gets eliminated in the feces. So this is the pharmacokinetics and pharmacodynamics of doxycycline. So what are dosage and administration? We give it as 200 mg IV stat followed by 100 mg twice daily, oral or IV. And the key thing about doxycycline is enough hydration has to be given when doxycycline is administered. Maximum dose is 300 mg per day. In children, it is used at 2.2 milligram per kg once a day or twice a day. And another distinct advantage of doxycycline is the low dose doxycycline, 20 mg twice a day, is used in various skin conditions like acne and rosacea. And in fact, when I was a teenager, I was given doxy at a low dose. So this is used as treatment for acne. So now I'll take you through the pictorial narrative of all these organisms it covers. So clinical use, respiratory infections, will go system wise. So respiratory infections, it has a good effect on mycoplasma, you have chlamydia and legionella. And it has a good effect on streptococcus and haemophilus influenza, but there is increasing resistance to streptococcus. Up to 5 to 25% of them have resistance. So it is suggested that doxycycline should be used in combination with beta-lactam antibiotics when you are using against respiratory infections. And if you look at IDSA guidelines, it suggests that for community-acquired pneumonia who are ambulatory, so ambulatory patients with community-acquired pneumonia, doxycycline is one of the drugs suggested by IDSA, which means it's a good pathogen, it's a good antibiotic for respiratory infections, especially for atypicals. And even acute exacerbation of chronic bronchitis, doxycycline is found to be superior to first generation cephalosporins, like cefaclor or cephalexin. So we'll move to genitourinary infections. For non-gonococcal urethritis, doxycycline for 7 days is found to be very effective. And 97% of the times the treatment is successful for non-gonococcal urethritis. And if it is a prostatitis, doxycycline is given for 4 weeks. And doxycycline was found to be very effective against ureaplasma urealyticum, which typically causes these genitourinary infections. And if you look at the CDC guidelines for pelvic inflammatory diseases, the drug of choice recommended is doxycycline with ceftriaxone plus or minus metronidazole. So they have compared, this was a Brazilian study to compare, see what happened was with the advent of macrolides, I think doxycycline usage has significantly come down because the use of macrolides is found to be a lot more convenient. So this was the study, if you see, where they compared ceftriaxone with azithromycin, which was given into 3 doses for 2 weeks, when compared with ceftriaxone plus doxy every day for 2 weeks. So this was given only 3 doses over 2 weeks. I think they found better results with ceftriaxone and azithromycin. So that's why there is an underemphasis right now on use of doxycycline. So these are sexually transmitted disease, lymphogranulomatous venereum and granuloma inguinal. So lymphogranuloma venereum is caused by Chlamydia trachomatis. So that's how the organism looks. And granuloma inguinal is caused by Klebsiella granulitis. So doxy is the treatment of choice for 3 weeks. Lymphogranuloma venereum and granuloma inguinal. So I think what is relevant for our ICU is this disease condition. So in rickettsial fever. So rickettsia are cell wall deficient bacteria. So it can cause 3 types of disease conditions: spotted fever, typhus and scrub typhus. So what we typically see in India is the scrub typhus. So and I think the role of doxy is, and the discussion is more important in this area for us. And as you know, it's caused by rickettsial organisms and it has a vector which is a flea or a tick. So doxy recommended dosage is 100 mg twice a day for 5 to 7 days and the response is pretty rapid. It is also effective against Ehrlichia species and Anaplasma phagocytophilum. So these are the other bugs that it is effective against. And doxycycline is effective against Q fever also, which is caused by Coxella burnetii, where doxycycline is given 100 mg twice a day for 14 days. But the Coxella burnetii is notorious to cause infective endocarditis. So this is how the Coxella burnetii looks. So if there is an infective endocarditis due to Coxella burnetii, then doxy should be given along with hydroxychloroquine for 18 months as a treatment of choice. So in India, rickettsia. So these are the different rickettsial organisms present worldwide. In India, the commonest scrub typhus what we see is caused by this Orientia susugumushi. So this is the one which causes scrub typhus or rickettsia conori. So these are the two agents which cause scrub typhus, and the reservoirs are rodents and dogs. So these are the ones, and the vector is mite and tick. So these are the ones which we find typically in India, which we see. So let's look into the studies done in this area. So I think these infections come under the category of acute undifferentiated fever. So this was a study that was published in 2016 in Journal of Global Infectious Disease by Indian authors. So they did a study of acute undifferentiated fever of 1258 patients, and they found scrub typhus was the commonest sort of an organism causing this fever, followed by dengue, followed by malaria. And if you see, the mortality was much higher in scrub typhus when compared to dengue and malaria. It was 5.1% compared to 2.3%. So what this study really emphasizes is the occurrence of scrub typhus seems to be a lot more prevalent. So we need to look for it in patients who present with the features which is suspicious of this acute undifferentiated fever or tropical infections. So this was another study which was published in 2017 again by Indian authors. As you see, scrub typhus was much ahead compared to dengue. So 47% of acute undifferentiated fever had scrub typhus, followed by dengue, which was 17.4%, followed by malaria. Which means to say, as of now, because as you see, these are fairly recent data, we are seeing more occurrence of scrub typhus than dengue, at least from the clinical studies that has been done. So this was another study, Subbarayadu, which is come as late as 2019. Surprisingly, this study came from Vizag. So here they showed that malaria was the commonest occurring rate. Although I would say in Bangalore, where I come from, malaria is almost absent now. I think what we are seeing more is scrub typhus and dengue, even in our part of country. So in this Vizag study, you see dengue is the second and scrub typhus is third. So which means to say scrub typhus occurs in top 3 causes of acute undifferentiated fever in India. Or if you have to say tropical infections, I think scrub typhus seems to be there in top 3. At least from the 2 studies, it seems to be the most commonly occurring infection. So this was another study which came in 2015 to look at what do these patients of acute undifferentiated fever or scrub typhus present with. Predominantly it is fever. 100% of them had fever and very non-specific symptoms like headache in 32% and myalgia in 23% and cough in 36%. So if you look at the signs, at least from this study, they said 77% of the times, if you look and examine carefully, there is presence of eschar. So we need to really look at eschar very carefully, very judiciously in all the skin creases. I think that is where you get to find the eschar. So 77% of the time they have eschar as a sign which should highlight the point that these patients may be having scrub typhus. Followed by liver dysfunction, icterus in 23% and lymph nodes in 11% and hepatomegaly was present in 52% of the patients. So these are the common signs. So when they looked at the common laboratory findings, you will see the liver dysfunction of the commonest. So 36% of them had raised bilirubin and 32% had raised enzymes. So which means to say upfront it tends to affect the liver and they can have hepatomegaly. So this is what we can find out, and they can come with non-specific symptoms. So this was a CMC study. I think as you see, J.V. Peter, a good friend, I think they did this study in CMC and they found in their study in scrub typhus, respiratory manifestation was the commonest. When they looked at organ dysfunction, respiratory dysfunction, which means they can present with hypoxemia in 96.6%, followed by cardiovascular dysfunction, which I assume will be hypotension, and followed by hematological and liver and renal. So if you see, the common organ dysfunction is respiratory, followed by liver, hematology, low platelets, and acute kidney injury possibility. So these are the commonest organ dysfunction scrub typhus presented with. So that's about the role of doxy in scrub typhus. And so what we can subscribe to is the commonest occurring in tropical infection would be scrub typhus, followed by dengue, if you watch with those two studies done. And the commonest presentation of will be liver dysfunction with raised bilirubin and hematological manifestations and respiratory and non-specific symptoms of fever and headache. So we'll talk about malaria. So malaria, doxycycline can be used as a chemoprophylaxis. So the dose is 100 mg once a day. It is given as a prophylaxis 2 days prior to someone entering the endemic area. And after they enter the endemic area, the prophylaxis has to continue for 4 weeks. This is extremely important for all of us. The reason being, if you are unaware, because one of my neighbor who went to Africa, who came back from Africa without chemoprophylaxis, was quarantined in a hospital. So, which means to say, even our Indian airport authorities can be strict about it. So, it is very important that even if you come back from Africa, I think the prophylaxis has to continue for 4 weeks for malaria. But that my neighbor was quarantined not for malaria but for yellow fever. So other agents used for chemoprophylaxis is mefloquine and atovaquone and proguanil. But I think the easiest one for us to use is doxycycline. So how about treatment? Even it has a role in treatment for both Plasmodium falciparum and Plasmodium vivax. So in uncomplicated malaria, you can give artesunate with doxy 3.5 mg per kg. If you look at WHO guidelines, the recommendation is you combine artesunate with doxy for 7 days. Even in complicated malaria, you give IV artesunate plus IV doxy if it is available, or clindamycin. So this is the treatment recommended by WHO, which means doxycycline has a very important role for prophylaxis and treatment of uncomplicated and complicated malaria of both falciparum and vivax. So what about leptospirosis? So it has a good effect against leptospirosis. So this was a study done from Thailand where they looked at 540 patients. They compared between penicillin versus doxycycline versus cefotaxime, and they found that the fever reduction was significantly much better in the doxycycline group as compared to the other groups. So graphically it is shown the number of hours of fever significantly came down when doxy was used compared to penicillin G and cefotaxime. And prophylaxis for leptospira, because if you have a area which is face the wrath of the floods or any other water logging, I think if you have to protect your patients from leptospirosis, I think the prophylaxis that one has to use is 200 mg doxy once a day, single dose. And protective efficacy with this prophylaxis was 76.8%, which is a reasonably good prophylaxis effect. So anyone identifies these organisms? So this is Helicobacter pylori. So doxycycline is used as a second line if there is a resistance to clarithromycin, which is one of the drugs used in H. pylori prophylaxis or H. pylori treatment rather. So this is the H. pylori. So if there is a resistance to clarithromycin, doxycycline is used as a second line. So this is Whipplish disease caused by Tropharma villi. So here you use doxycycline with hydroxychloroquine for 1 year, because this causes a GI disease. So you would use doxycycline with hydroxychloroquine for 1 year. So anyone identify this bug? This is cholera, Vibrio cholera. So doxy is the drug of choice for Vibrio cholera. Although these two studies, one from Japan and India, is showing increasing resistance of Vibrio cholera to doxy, and it is effective even against Aeromonas. So these are Aeromonas organisms. Okay. So and it has good effect against all miscellaneous infections. So Bruzelosis is not an uncommon condition. So it is one of the important cause of PUO, pyrexia of unknown origin, especially in patients who deal with livestock. So this is the Bruzelosis organism. So doxycycline is given for 45 days. Initial treatment is combining doxycycline with streptomycin or gentamicin, followed by doxycycline for 45 days. Or doxycycline can be used along with rifampicin for 45 days, or doxycycline with rifampicin with aminoglycoside if the intent is to reduce the relapse rate, especially if someone is associated with livestock. Can anyone identify these organisms? This is Nocardia. So these are all exotic organisms which can be cause for PUO, fever of unknown origin. So doxycycline or newer generation Tetracycline like minocycline is the drug of choice for nocardia. Melioidosis, we used to see it in Australia. It is not uncommon. It is present even in India. Melioidosis is caused by Burkholderia pseudomyelli. So the treatment of choice is IV ceftazidime for few days, followed by doxy with cotrimoxazole for 3 months. So melioidosis can cause multi-organ dysfunction and respiratory manifestations. So one needs to be aware of this condition. So these are all typical causes one would look for any PUS. So tropical sprue, tropical sprue is a condition where the etiology is little uncertain and various hypotheses is there. So doxy is used for 3 to 6 months as a treatment for tropical sprue. So this is, as the picture you see, it's a rat bite fever caused by Streptobacillus moniliformis. So drug of choice is penicillin or doxycycline. I think this is a very interesting area, filariasis, where there is, very difficult to treat condition. So there is this organism called Wolbachia. So this acts as an intermediate, this acts as a bacteria, intermediate bacteria that is needed for the filaria to complete its life cycle. So doxycycline is effective against this Wolbachia. By eliminating this bacteria, so you can cut the life cycle of filaria, and it has found to be effective. So they have used doxycycline for 6 weeks to eliminate this Wolbachia, which acts as an intermediary for completing the life cycle of filaria. Okay, so we spoke about all those exotic infections. What about non-infectious conditions that can be treated? So doxycycline has a good role to play even in non-infectious causes like autoimmune conditions. So it is used in sarcoidosis, rheumatoid arthritis, and systemic sclerosis for as an immunomodulatory effect. And doxycycline has been used in pyoderma gangrenosum as well. And this I found interesting. So doxycycline is shown to prevent breast cancer metastasis. So, and the way it is shown to prevent the breast cancer metastasis is by what initially I said, inhibition of matrix metalloproteinases. So there are studies which have shown it reduces or it prevents the breast cancer metastasis. Okay, now we'll move to the potential agents of bioterrorism. I think it is a magical drug, especially so the agents that typically cause or used for bioterrorism is anthrax. So for cutaneous anthrax, doxy is used for 5 to 7 days, and inhalational anthrax, which is more severe form, the combination therapy is used along with doxycycline. And tularemia is another biological warfare agent. So aminoglycoside streptomycin or gentamicin is used as a drug of choice for tularemia. Doxy is used for less severe cases. Plague, I think if you remember 20 years back, even India had a outbreak of plague in Gujarat. So plague, which is caused by Yersinia pestis, if you look at organisms, it does look scary. So doxy is used for 5 to 7 days as a treatment of choice for plague. So these are typical biological warfare: anthrax, tularemia, and plague. So now we'll move to the last bit, whether doxycycline has a role in this day and age where we are dealing with a lot of MDR and XDR organisms. So this was a study to look at role of doxycycline in MDR organisms. This came surprisingly from India. So if you see, they have compared imipenem, meropenem, and doxy, and they have looked at the susceptibility of MDR Acinetobacter to doxy, and they found that susceptibility of doxy was comparable to meropenem and other carbapenems, imipenem. And MDR Acinetobacter, so doxycycline susceptibility of 66.67%, which was better than meropenem and imipenem. So which goes on to show doxy can be a good adjunct drug when you are dealing with MDR infections as well. And we have seen it in our practice where you may have resistance to even carbapenem. Sometimes we see sensitive to doxy and sensitive to colistin. So since there is not too much of a over usage of this drug, I think this antibiotic is reasonably spared, and we are seeing some sensitivity to these MDR organisms. So this was a tabular column looking at sensitivity of these MDR organisms to various drugs, and doxy performed significantly better, and it was comparable to carbapenems. So what about safety? I think with regards to the side effects, most side effects are related to the skin. So doxycycline can cause urticaria, can cause maculopapular skin rashes. It can cause fixed drug erections, severe itching is a possibility, and it can cause photosensitivity. And like any other antibiotics, there have been reports of it causing Steven Johnson syndrome or toxic epidermolysis, toxic epidermal necrolysis. So it can cause severe acid peptic problem with vomiting, nausea, and can cause diarrhea. So GI manifestations are quite common, and it is shown to cause severe esophagitis and lot of esophageal ulcerations. So that is the reason there is a lot of emphasis on adequate hydration and to be eaten with food or after food, so that you can mitigate this problem with severe acid peptic problem. And there have been reports of doxycycline causing visual field defects. In rare instances, it is known to show to cause benign intracranial hypertension. So these may be little rarer, but the commonest adverse effects would be the skin manifestations, followed by GI issues, nausea, vomiting, and gastritis. And yellow teeth is another problem, especially if you give doxy in young kids. I think bone formation and yellow discoloration is a problem, and yellow discoloration can also happen in adult patients. Yellow discoloration of the teeth, so which can be quite annoying with the usage of this drug. So the suggestion has always been like doxy to be had with good hydration and lot of water. So is there resistance to doxy? So they have identified these genes called TET plus OTR genes. So these are the genes that are acquired which confers resistance. And resistance is conferred by these porin mechanisms and by preventing the binding of doxycycline to the ribosome. So these genes, once it is acquired, so it is acquired by inhibiting the binding of doxycycline to the ribosome, because as you know, doxycycline predominantly acts by binding to 30S and 70S ribosome and by porin formation. So I think these are prevented. And there has been increasing reports of resistance to doxycycline by these organisms. So this is Enterobacteria, Pseudomonas, and this is cholera, this is Staphylococcus, Strep Enterococcus, and Chlamydia. So there is reported increasing resistance to these organisms. So the take-home message for doxycycline is, as you see, doxycycline has a very broad spectrum of activity against the atypical bacteria and also a lot of exotic organisms. And you have seen multiple organisms like Yersinia pestis, tularemia, and it's a drug of choice for pelvic inflammatory disease like non-gonococcal erythritis or lymphogranuloma venereum. So, or you have this rat bite fever, so Borrelia. So I think it Leptospira. So most importantly for us, what is of importance is rickettsia, Leptospira, and malaria. So and it has a wide area of clinical usage. And doxycycline has been mentioned in literature as a secret weapon for infectious disease specialists, especially when you are thinking of any exotic organism causing fever of unknown origin. So it becomes a secret weapon where you have tried all antibiotics, you want to throw in for these any of these exotic infections like milioidosis or Coxella burnetii or any of these organisms. Good thing is it is well tolerated, and it's a drug of choice for rickettsia, brucellosis, anthrax, Q fever caused by Coxella burnetii, and it is a drug of choice for atypical respiratory pathogens like Mycoplasma, Chlamydia, and this is Legionella. And it is a drug of choice for all the STDs like lymphogranuloma venereum or granuloma inguinale. And most importantly, for Indian subcontinent, it is a useful drug for prevention and treatment of malaria. So thank you very much. I would end with this quote: great minds have purposes, others have wishes. So you can visit my website www.drpradeeprangappa.com to rehear to this lecture to gain clarity and insights. Thank you.